Hi, in this video, we're going to talk about the operation and the techniques involved with breast implant surgery. Now, during the operation, there's some things that we focus on to improve your chances of getting a great result in the short term, getting you back to normal activities, sore but functional, 24 to 48 hours after surgery, as well as long-term decrease the risk of problems and increase your chances of having a great result long-term. And what we're going to focus on is something called capsular contracture and decreasing the risk of capsular contracture. Now, anytime we put an implant inside your body forms scar tissue around that, and that's called the capsule. And over time, for multiple reasons, that capsule can get thick and firm and hard around the implant and can distort the implant, can actually cause the shell to crack and cause some problems. So we want to decrease the capsular contracture rate with surgery. And there's a bunch of things that we can do to manage that. And we think that some of the issues with capsular contracture surround inflammation. So we want to decrease inflammation at the time of surgery, and that will decrease the capsular contracture rates. And there's actually a website called saferbreastimplants.org that you can go to. It's an Australian-based website, but they have a doctor listing where you can find a doctor near you that ascribes to this 14-point plan to help decrease the risk of capsular contracture and get you these better results. In the first part of the surgery, you want to have your doctor use IV antibiotics before surgery, which is a pretty common thing. The other thing that we do is use what's called nipple shields, where we cover the nipple-areolar complex, because in the breast tissue itself, the milk ducts have bacteria. They're not sterile. So during the operation and stretching the skin, you can actually express bacteria from milk ducts onto the skin, and then that bacteria can get onto the implant or onto somebody's gloves during the operation, and that bacteria can cause inflammation. That inflammation can lead to some capsular contractures. And then the other thing that we want to do is actually avoid an incision around the edge of the areola, because indeed, in cutting through the nipple and areola area, we're going to be cutting through milk ducts and again, potentially exposing some bacteria to the implant, which can cause inflammation, which can cause earlier capsular contracture. Now, the next phase of the surgery is really creating the space for the implant or creating the pocket. And in doing that, we want to have what's called atraumatic dissection, or minimal injury to the tissues. That's going to decrease inflammation. That's going to help make your recovery quicker. At the time of surgery, you also want to have meticulous hemostasis. You don't want any bleeding with surgery. The technique that I use for the surgery has barely any blood loss. A drop or two is it for the entire operation. Anytime we see a blood vessel, we want to cauterize it, block it off before cutting it, because that's going to decrease the risk of a hematoma or a blood collection, and that's going to decrease your risk of infection as well. And then, as I said, with the incision around the areola or during the operation, you want to avoid cutting into the breast tissue itself. So you avoid cutting into milk ducts so that you avoid any potential contamination with bacteria onto the implant. The bacteria may not cause an infection, but it can cause that inflammation that increases your risk for capsular contracture. And then the final thing in creating the space for the implant is that we want to avoid cutting into that breast tissue, specifically by putting the implant in a place where it doesn't come into contact with breast tissue. And there's two places that we can do that. We can put the implant under the fascia, which covers the muscle and separates your pectoralis muscle from the breast tissue itself. So there's a place called subfascial that we can put the implant, or we can put the implant under the muscle. And both of those places avoid contact with the breast tissue itself, again, decreasing the risk of capsular contracture. Now, when we put the implant in, there's even more steps that we need to take to decrease the risk for capsular contracture. So the first thing is that your surgeon should change their gloves even though we're working in a sterile field, we want to change our gloves at the time that we're about to put the implant in. The other thing we want to do is to try to avoid contact of the implant with your skin. So a lot of surgeons will use what's called a funnel or clean off the skin with antiseptic soap once again, right before putting that implant into the pocket to decrease the risk of contamination again. And then another thing that we do is that we minimize the time that the implant is open from its sterile packaging. So what we'll do is we'll have the funnel ready, we'll have changed gloves, we'll have new instruments, and we'll open the package, irrigate that implant with some antibiotic solution, put it right into the funnel, put that right into the pocket, and that may just take a couple of seconds. Now, the final phase is when we close the incision. We want to avoid using drains, and then we want to do a layered closure. And both of those things decrease infection rates, decrease capsular contracture rates. So those are kind of all the steps in the 14-point plan on the day of surgery that's going to lead to decreased inflammation. In the short term, that's going to help with your short-term recovery, and then in the long term, it's going to decrease your capsular contracture rate. So I hope this has been helpful and educational, and stay tuned for the third part when we talk about the third phase of getting a great result, which is the recovery program.